Did you know that many glaucoma patients might miss out on your branded medications simply because we're unsure how or when to prescribe them? These drops can offer unique mechanisms, better tolerability, and simpler regimens, but only if we're confident about how to integrate them into practice. Hello, I'm Dr. Constance Okeke, an Ivy League-trained, board-certified glaucoma specialist, and welcome to Branded Glaucoma Meds, what every ODMD should know, an editorially independent video series supported by Alcon and Bausch & Lomb. In this episode, we're exploring the role of branded glaucoma medications, what sets them apart, how they fit into our treatment toolbox, and why they might be worthy considering for better patient outcomes. If you're passionate about staying current in glaucoma management, give this video a like and subscribe so you don't miss what's coming up. The evolution of glaucoma pharmacotherapy. Glaucoma pharmacotherapy has evolved dramatically over the decades. In the 1970s, treatment revolved around miotics like pilocarpine and beta blockers such as timolol, which eventually became generic workhorses in our field. The 1990s brought a major leap forward with the introduction of prostaglandin analogs like Vyzulta or latanoprost, offering significant efficacy and convenient once-daily dosing. Then, fixed-dose combinations arrived like Cosapt or dorzolamide timolol, and later Simbrinza or brinzolamide vermonidine, allowing us to reduce drop burden and improve adherence for patients needing multiple drug therapy. A significant milestone came in 2012 when the first preservative-free prostaglandin analog, Vyzulta or tafluprost, was approved in the United States. This opened doors for patients with ocular surface disease or sensitivity to preservatives like VAK. Since then, more preservative-free or low preservative branded options have emerged, such as Vyzulta, latanoprost preservative-free, Timoptic and Ocudose, timolol, and Cosapt PF dorzolamide timolol. These innovations have been particularly valuable for improving comfort and adherence in patients with ocular surface issues. If there's a drop you remember as a game changer in your practice, drop its name in the comments. I'd love to hear your thoughts. How branded and generic glaucoma meds differ. It's also important to understand how branded and glaucoma medications differ. Branded glaucoma medications are developed through extensive research and clinical trials to establish safety, efficacy, and optimal formulations. Many include proprietary delivery systems or unique preservative profiles designed to enhance tolerability, stability, or patient adherence. When a branded drug's patent expires, generic manufacturers can produce versions of the medication. While generics must match the active ingredient, strength, and route of administration, they may differ in inactive ingredients like preservatives, buffers, and formulation vehicles. These subtle differences can sometimes affect tolerability, comfort, or even drug absorption in certain patients. That's why some patients who experience side effects or inadequate control on a generic version might do better when switched back to the branded product. Let me know in the comments if you've ever had a patient who couldn't tolerate a generic but did well on the branded version. It's a situation we all encounter. When and why clinicians consider branded meds. Some branded drops combine mechanisms for greater IOP reduction, like Rocklatan, which merges a rho kinase inhibitor, nirtacidil, with a prostaglandin, latanoprost, or Vyzulta, latanoprost and Brunad, a nitric oxide donor plus prostaglandin analog. I often switch to these medications for patients whose target pressures aren't met with generics. Branded formulations often minimize preservatives or use gentler alternatives. Examples include Vyzulta and Vyzulta, as well as Timoptic and Ocudose, Cosapt PF, which are all preservative-free, Zelpros, which has a non-VAK formulation, and Alphagan P, which uses purite as a non-VAK preservative. Here's a tip. Consider these drops in patients with ocular surface disease, VAK intolerance, or allergies. Switching to preservative-free or alternative preservative drops can improve comfort and adherence. Fixed-dose combinations like Simbrinza, Rocklatan, and Cosapt PF simplify regimens by reducing bottle drop burden and drop fatigue. Fewer bottles can also mean less ocular surface disease and better compliance. Branded options can sometimes cause less redness, stinging, or daily routine disruption. Discussing these options openly helps patients feel involved and confident in their treatment plan. If you're finding these tips helpful, go ahead and subscribe so you don't miss future episodes. The innovation pipeline. We're also moving beyond daily drops. Implantables like Durista, a bromidiprast implant, and Idos TR, a travoprost implant, deliver sustained drug release directly inside the eye. These branded innovations show how the field is constantly pushing boundaries. How to integrate branded options into your practice. To integrate branded meds successfully, 1. Define your patient's IOP goal and review prior medication responses. If you want guidance on determining a target pressure, check out my 5-step guide in the description box. 2. Assess ocular surface health and preservative tolerance. 3. Discuss cost and coverage upfront. We will be discussing that on an upcoming episode on drug access. 4. Whenever possible, have samples available. Samples let patients try the medication first to assess tolerability before purchasing. They also eliminate an extra pharmacy trip, increasing the chance that patients actually start the therapy that same day. 5. Trial the medication and closely monitor efficacy and side effects. A structured approach ensures you match the right medication to the right patient and helps improve the chances you'll stick with plan. So that's a look at how branded glaucoma medications can offer unique benefits and why it's worthy of considering them thoughtfully in our treatment plans. If you'd like a handy reference listing all the available glaucoma medications in one place, I put together a free cheat sheet you can download. Check the link in the description box below. And speaking of going that extra mile, have you ever wished you had a drop that packs even more punch for IOP control? In our next episode, we're putting the spotlight on Rocklatan and how it can help you hit those tough pressure targets. It's queued up next, and I'll see you there. And as always, don't forget to like the video and subscribe to iGlaucoma and share your own tips or questions in the comments. Let's keep finding ways to help our patients see better and live better.